Case conceptualizations. In a case conceptualization, the clinicians use data collected as part of a biopsychosocial assessment to construct an understanding of how families develop and maintain problems, as well as what the therapist can do to help the family change. In the situation of families, therapists assess many of the typical parts of a biopsychosocial assessment, as well as family structure, formal roles, and patterns in the family that might produce and sustain family problems. A useful way to get a picture of a family structure and dynamics is through genograms and ecomaps. Genograms depict the multiple generations in a family, including health and mental health problems, births and deaths, and relationships between family members. Ecomaps, on the other hand, indicate the relationships between family members and their larger environment. Thus, sources of support and stress, as well as relationships between social institutions, are visibly depicted and give the viewer insight into the family relationships with their ecological environment. Combined, ecomaps and genograms can help practitioners visually identify the structures within families and potential patterns. Roles are another relevant feature of family life, in that family roles provide indications to family members what are the responsibilities, as well as how to interact in the family and with the outside world. Moreover, some family roles are clearly identifiable, as in caretaker or wage earner, whereas some family roles exist under the surface and are not clearly discussed, but tacitly assigned and demonstrated. Examples of these informal roles include power broker, hero, and scapegoat. Families typically have both informal and formal roles, and these formal and informal roles should always be assessed because they relate to how families function and their dynamics. Patterns, the last piece, are the ways that families are socialized to interact with each other and the outside world. Patterns, therefore, are tacit behavioral expectations that might give way to support problems or solutions. Families might not be aware of these patterns, but enact them during their social interactions and many times in therapy sessions. Examples of family patterns include conflict resistant and avoidant, sexualized, or stoic. Thus, to understand families, as well as why a child or adolescent acts a particular way in a particular setting, social workers must create case conceptualizations that dive deep into the many ways that families are structured, the roles within families, and the patterns that both support and deter families or children within families. These conceptualizations then inform treatment goals and objectives for a child or an adolescent, as well as a family.